Hello, my name is Victoria Mahoney and I'm here with your monthly therapy moment. Are you pregnant? Considering becoming pregnant or postpartum? You recently had a baby? You might be wondering, why is this so hard? And I can tell you there's a lot of reasons why it is hard. And the fact that it is challenging is extremely normal. You are not alone in that. Perinatal mental health refers to the time period of preconception and pregnancy and 1 year postpartum. So in that period, we tend to focus on, understandably, the health of the baby. Is the baby doing okay? Are they reaching their milestones? And we sometimes neglect the health of the mother and the mental health of the mother and the other parent as well. So during this perinatal mental health period, we start to see symptoms sometimes of depression. Yes, that is one aspect. Postpartum depression is common, but also we can see symptoms and signs in rage, intrusive thoughts, feeling disconnected or not having that bond that we would have expected to have with our baby, a sense of grief and loss also, especially depending on the journey that it took to become pregnant or if there was loss of any kind during that period, either trying to conceive or thereafter. So why does this happen? Why do we start having these symptoms? Well, of course, hormones play a massive role. You are undergoing a huge transformation and a massive shift in your life, not only personally, but in your relationship, in your family system as a whole. So it's only natural to feel these things. And really what it comes down to is that these are very, very treatable conditions. They're very treatable symptoms. Something that I also see go rather undiscussed is the profound impact that pregnancy and birth of a child can have on a couple. And this is where Solid Foundations comes in. Not only can we work with you on the individual level, but we can support you in your marriage and in your relationship as well. So many couples come in and partners, especially of people who just gave birth, and they're wondering, how do I support? What do I do? I don't feel like my mental health is getting the recognition that, my wife's is, and she just had the baby, yes, but I have needs too. There's so many things that happen, intimacy changes, just communication challenges, resentments that subtly and quietly build over time. And I will tell you again, these things are treatable, they're manageable. We have tools to teach you that can help lessen the intense negative impact that having a baby can have on the relationship. Yes, it is meant to be a joyful time. And yes, in large part, there is a lot of joy involved, but there is a lot of hardship. There is a lot of confusion. There is a lot of identity uncertainty and even just uncertainty of, do I matter in my partner's life anymore? And again, that's where couples therapy can come into play, and that's where we can support you. You are not alone. It does get better. And I recognize that it is a very, very difficult period. You're learning a lot. You're sleep deprived. There's so many aspects that go into this. So please do the outreach when you need help. If you're seeking some additional support, Solid Foundations is here. We would love to be part of your support network during this special time and all the challenges and joys that it brings.